little smoke in the air, maybe seeing haze around your house. It is happening all over Metro Atlanta. Smoke traveling hundreds of miles from massive wildfires burning near the Georgia-Florida state line, and it could be impacting your breathing. We want to bring in Dr. Lily Hwang from Atlanta Allergy and Asthma. Really appreciate the time as so many people are seeing the effects, maybe feeling the effects of these wildfires as they breathe. Are you seeing more patients, hearing from more people as these conditions continue to intensify?
We are. So when we see our patients, most of our patients have asthma, or they can have asthma, and they have allergic rhinitis symptoms. And with the fire being as what they are, the high levels, it can actually get into your lungs. So the particulate matter is what we worry about. Is the really, really small, particles that actually go into the lower levels of your lung. You see this with the wildfires because that is what they release into the air. And so our asthmatics are more, susceptible to this. Your young children are susceptible. The elderly are also more susceptible. We do get patients who have more coughing. You get more irritated lungs. You can feel kind of chest tightness. Some people feel short of breath. And then you also get the respiratory, like upper stuff. People kind of get congested. They get headachy, all those things as well. Now, I want to also understand that when you look at this air quality, sometimes we can actually hit into the red or into what we consider dangerous for all, patients. Those people who don't have a respiratory problem can also have symptoms and issues with this, because when it gets to that level, anyone can be impacted. And this is where we encourage people to stay away from outside, because it is going to be a problem, regardless if you have asthma, regardless if you have any respiratory condition. When it's that high, you're susceptible as well.
That's a really important point. Maybe people who deal with respiratory challenges on a day-to-day basis might have a heightened sensitivity in terms of knowing that they need to respond differently when there are particles in the air. But for people who don't really have that on the radar, they might not be thinking as much about, like, oh, I should limit my time outdoors. Maybe I'm thinking about my kids' school recess. Are we at a point where we really need to be taking those kinds of measures? For me as a mom with kids who don't necessarily have maybe some allergy-induced asthma, but for someone who doesn't necessarily fall into the category of having respiratory illness.
Correct. So, it does vary by kind of where you are, but for the most part, we have been seeing pretty heavy levels. And so once we kind of get to that, I do encourage those, like if you're a runner, you might not want to be out there running in the next couple of days, and since it's been in kind of the high moderate zone. And then of course with children, try not to keep them outdoors for as long, because that exposure can cause problems as well. Of course, our asthmatics, I always want to kind of say, if you do have a respiratory condition, make sure you're talking to your allergist or talking to your physician about what my step up plan is. And so if you're kind of the person who knows that you'll get sick with exposures like this, you might need to step up your medicine. You may need to add extra medicine so that you don't get so sick.
What kind of symptoms should people be looking for to that might maybe peak? Like, I need to either check in with a doctor or maybe pursue some medication.
Yes. And so a lot of times it get into your lungs. So a lot of times people feel chest tightness, shortness of breath, they get coughing, things that, if you take your rescue inhaler, it gets better, then, you don't have to seek the care immediately. If you take your medications for your asthma and you're not getting relief, then you do want to talk to your physician or your provider to kind of help you with this and figure out, medicine is just not enough. If we have to do more, we have to call in some medicine for you.
Dr. Hwang, we're also maybe having two things colliding here. I'm curious, we've got the smoke particles from wildfires burning in many parts of our state right now, but we're not out of the woods in terms of allergen season. Pollen's still out there. There's some trees and molds. Talk about maybe the intersection of those two things and how that might affect somebody. Oh, I think we might have lost Dr. Hwang. Just keep in mind. Oh, are you there? Are you there, Dr. Hwang?
I am. I'm not
good.
sure what happened. Connected. Sorry about that.
Okay, I'm so glad you're back. I was curious, you're talking about the smoke particles is one factor for certain, but then there's still some pollen that's looming. We're not of allergy season just yet with molds and trees. Are those two things intersecting, making it harder on a lot of people?
Unfortunately, that is very true. So with our pollen count being as high as it is, we've had longer, days in the high level that actually can cause more symptoms. So now you've got your respiratory tract with the allergies, flaring on you, and then you also add in the particulate matters that are causing problems. And so a lot of patients will be dealing with both, and that's an add-on problem for them. And then that means that, sometimes we have to step up more medicines, watching out for all those conditions, making sure you're doing your environmental control measures as much as you can so that you're really decreasing those exposures down.
Oh, I'm glad you talked about the control measures because we've gotten some questions about should I consider pulling out a mask or does an air purifier help? Do things like that help or what would you recommend for people?
So, for your general allergies, a lot of times patients like to, when the weather starts, they want to keep their windows open, but we strongly encourage you to keep your windows closed so you don't actually have the pollen kind of coming indoors to you. And then the other thing is that, with what we're getting outside, you don't want it inside your home if you can. And so, windows closed, don't, drive with your windows down. If you've got a home, make sure your HEPA filters are, you're using good HEPA filters so that you can kind of take care of that as well. Air purifiers can help in certain, situations, but keep in mind that sometimes the things you're using the air purifier for, like the allergens are pretty heavy. If they're heavy, they don't actually, the air purifiers don't work that well for those heavy allergens.
All right. Well, we really appreciate the time. Dr. Lily Hwang with Atlanta Allergy and Asthma. I know you are really busy on a regular day, but you have all these other factors swirling around, and we know you're extra busy. So thanks for taking a few minutes to help educate us on what we can do and steps we can take to be safe as these fires keep burning. Thanks for the time.
Thank you for having me.